everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as fentanyl. Its brand name is Duragesic. Now before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. So fentanyl acts primarily on the opioid mu receptors located in the central nervous system. These are located generally in the brain, the spinal cord, and some other tissues. This medication can cause analgesia, mood alterations, euphoria, dysphoria, and drowsiness. Fentanyl also has the ability to depress the cough reflex and the respiratory system. In terms of indications for use, fentanyl is indicated to be used in the treatment of breakthrough cancer pain in opioid-tolerant patients, so patients who have used another opioid in the past. Fentanyl can be used for chronic severe pain in individuals who are opioid tolerant and require around-the-clock opioid therapy. And lastly, fentanyl can be used for short-term management of post-operative pain in a hospital setting. Now, before somebody was to use fentanyl, there are some contraindications that they must clear, as well as some precautions and warnings that they should be made aware of. Fentanyl cannot be used by individuals who have acute or severe bronchial asthma. Patients with a known or suspected gastrointestinal obstruction cannot use fentanyl. If a patient had a hypersensitivity to fentanyl or any other component of the product, they would not be able to use this medication. This medication can't be used for mild or intermittent pain management, and it also cannot be used by patients who are not opioid tolerant. And lastly, fentanyl cannot be used by patients who have significant respiratory depression. Now, in terms of precautions, fentanyl is on the Beers criteria, which is a list of medication that the elderly population should either avoid or use cautiously. Because of the impaired psychomotor function and sometimes syncope that may occur with this medication in the elderly population, it may put them at an increased risk of falls. And in this population, falls can lead to fractures. Patients should be made aware that abuse, misuse, and opioid addiction has occurred with the use of fentanyl. Placing the patch in the mouth, chewing it, or swallowing it, or using it any other way besides how it's directed can result in overdose and sometimes death. Patients should be made aware that bradyarrhythmias may occur. They should be monitored for this, and they'd be at an increased risk of experiencing the bradyarrhythmias during the initiation of therapy. Severe hypotension or low blood pressure, including orthostatic hypotension, which is a drop in blood pressure when going from a seated to a standing position, has occurred with the use of fentanyl. This can sometimes result in syncope or fainting, and patients would be at an increased risk of experiencing this if they're using other CNS depressants. Topical skin reactions to the patch may occur, and the medication will be discontinued if these reactions were severe. Patients should be made aware that opioids in general can lead to adrenal insufficiency. Clearance of the medication may be decreased in patients who have hepatic impairment. Potentially life-threatening serotonin syndrome has been reported with the use of fentanyl. Patients would be at an increased risk of experiencing serotonin syndrome if they're using other medications that affect serotonin, such as SSRIs or selective serotonin reuptake inhibitors. Clearance may be decreased in patients who have renal impairment, and if the renal impairment is severe, they should avoid using this medication. And patients should be told that abrupt discontinuation of fentanyl may lead to withdrawal symptoms. Now, once somebody is cleared of the contraindications and made aware of the precautions and warnings, and they start to use fentanyl, they would receive their dose through a patch. If somebody is converting their dose from morphine to fentanyl, and they were using 60 to 134 milligrams per day of morphine, they would typically start off with a patch of 25 micrograms per hour. They would wear this patch continuously and replace it every 72 hours. Some patients who do not receive adequate benefit or pain relief from the 72-hour dosing regimen can replace their patch every 48 hours under the instructions of their physician. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using fentanyl, so I'll go over some of those here now. Just keep in mind that this list is not all-inclusive. We mentioned that some patients may have an application site reaction to the patch. Up to 10% of patients may experience abdominal pain. Diarrhea or constipation may occur. Some patients may experience a loss of appetite, indigestion, or vomiting. Up to 10% may experience confusion or dizziness. Some patients may experience a feeling of nervousness, and others may experience insomnia. Anxiety and depression are possibilities with fentanyl. Patients may experience difficulty breathing, and others may experience an upper respiratory tract infection. Bradyarrhythmias or hypotension, low blood pressure may occur. Drug dependence and serotonin syndrome have been reported. And some patients may experience adrenal insufficiency. And lastly, seizure has been reported as well. That's all we're going to talk about today with fentanyl or Duragesic. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.